Welcome to ePathshala. I am Anita, faculty from the School of Medical Sciences, University of Hyderabad. Dear students, in today's module, we will focus on infertility, the causes and consequences. The word infertility means inability to conceive children or young. Infertility refers to an inability to conceive after having regular unprotected sex. Infertility can also refer to the biological inability of an individual to contribute to conception or to a female who cannot carry a pregnancy to term. According to World Health Organization, infertility is a disease of the reproductive system defined by the failure to achieve a clinical pregnancy after 12 months or more of regular unprotected sexual intercourse. Infertility is the inability of a sexually active, non-contracepting couple to achieve pregnancy in 1 year. The male partner can be evaluated for infertility or subfertility using a variety of clinical interventions and also from a laboratory evaluation of semen. Demographic definitions of infertility: an inability of those who of reproductive age 15 to 49 years to become or remain pregnant within 5 years of exposure to pregnancy. An inability to become pregnant with a live birth within 5 years of exposure based upon a consistent union status, lack of contraceptive use, non-lactating, and maintaining a desire for a child. Epidemiological definition of infertility for monitoring and surveillance. Women of reproductive age 15 to 49 years at risk of becoming pregnant, not pregnant, sexually active, not using contraception, and not lactating, who report trying unsuccessfully for a pregnancy for 2 years or more. It is one of the reproductive health indicators. Infertility as a disability. Infertility generates disability, an impairment of function, and thus access to healthcare falls under the Convention on the Rights of Persons with Disability. An estimated 34 million women, predominantly from developing countries, have infertility which resulted from maternal sepsis and unsafe abortion, long-term maternal morbidity resulting in a disability. Infertility in women was ranked the 5th highest serious global disability. Primary infertility. When a woman is unable to ever bear a child, either due to the inability to become pregnant or the inability to carry a pregnancy to a live birth, she would be classified as having primary infertility. Thus, women whose pregnancy spontaneously miscarries or whose pregnancy results in a stillborn child without ever having had a live birth would present with primary infertility. Secondary infertility. When a woman is unable to bear a child, either due to inability to become pregnant or the inability to carry a pregnancy to a live birth following either a previous pregnancy or a previous ability to carry a pregnancy to a live birth, she would be classified as having secondary infertility. Thus, those who repeatedly spontaneously miscarry or whose pregnancy results in a stillbirth or following a previous pregnancy or a previous ability to do so are then not unable to carry a pregnancy to a live birth would present with secondary infertility. Mascarenhas et al. In 2012 analyzed demographic and reproductive household survey data to reveal global patterns and trends in infertility. Independent from population growth and worldwide declines in the preferred number of children, they found little evidence of changes in fertility over 2 decades, apart from in the regions of sub-Saharan Africa and South Asia. There are 2 types of infertility. Primary infertility refers to couples who have not become pregnant after at least 1 year of having sex without using birth control methods. Secondary infertility refers to couples who have been able to get pregnant at least once but now are unable. Causes of infertility. Many physical and emotional factors can cause infertility. It may be due to problems in the woman, man, or both. Female infertility. Female infertility may occur when a fertilized egg or embryo does not survive once it attaches to the lining of the womb or the uterus. The fertilized egg does not attach to the lining of the uterus. The eggs cannot move from the ovaries to the womb. The ovaries have problems producing eggs. Female infertility may be caused by: first, autoimmune disorders such as antiphospholipid syndrome, otherwise called APS. Second, birth defects that affect the reproductive tract. Third, cancer or tumor. Fourth, clotting disorders. Fifth, diabetes. Sixth, drinking too much alcohol. 7. Exercising too much. 8. Eating disorders or poor nutrition. 9. Growths such as fibroids or polyps in the uterus and cervix. 10. Medicines such as chemotherapy drugs. 11. Hormone imbalances. 12. Obesity. 13. Older age. 14. Ovarian cysts and polycystic ovary syndrome PCOS. 15. Pelvic infection or pelvic inflammatory disease PID. 16. Scarring from sexually transmitted infection, abdominal surgery or endometriosis. 17. Smoking. 18. Surgery to prevent pregnancy, that is tubal ligation or failure of tubal ligation reversal, reanastomosis. 19. Thyroid disease. Now let us discuss male infertility. Male infertility may be due to decreased number of sperm, blockage that prevents the sperm from being released, defects in the sperm. Male infertility can be caused by 1. Birth defects. 2. Cancer treatments including chemotherapy and radiation. 3. Exposure to high heat for prolonged periods. 4. Heavy use of alcohol, marijuana or cocaine. 5. Hormone imbalance. 6. Impotence. 7. Infection. 8. Medicines such as cimetidine, spironolactone and nitrofurantoin. 9. Obesity. 10. Older age. 11. Retrograde ejaculation. 12. Scarring from sexually transmitted infections, injury or surgery. 13. Smoking. 14. Toxins in the environment. 15. Vasectomy or failure of vasectomy reversal. Healthy couples under age 30 who have sex regularly will have a 25% to 30% per month chance of getting pregnant each month. A woman is most fertile in her early 20s. The chance of a woman getting pregnant drops greatly after age 35 and especially after age 40. The age when fertility starts to decline varies from woman to woman. Infertility problems and miscarriage rates increase significantly after 35 years of age. There are now options for early egg retrieval and storage for women in their 20s. This will help ensure a successful pregnancy if childbearing is delayed until after age 35. This is an expensive option, but for women who know they will need to delay childbearing, it may be worth considering. UNISA in 1999 showed childlessness in Andhra Pradesh, India, with treatment-seeking behavior and consequences. She suggested that there is a clear need for infertility investigation and treatment to be included in the reproductive health program in India, and for health workers to be trained to provide information, care and referrals. Ganguly and UNISA 2010 showed trends of infertility and childlessness in India, findings from National Family Health Survey data. They inferred with increasing levels of educational attainment among women, infertility rate increases. This can be related to the fact that with aspirations for attaining higher educational level, marriage is delayed, as a result of which, in confirmation with aforementioned causation factors. Gigi Boy in 1998 explained that infertility has been relatively neglected as both a health problem and a subject for social science research in South Asia. Programs and research have focused upon the correlates of high fertility and its regulation rather than upon understanding the context of infertility, its causes and consequences. Infertility affects 50 to 80 million couples worldwide at some point in their reproductive lives and has a variety of biological and behavioral determinants. In pro-natalist countries such as India, there can be devastating consequences for women who are unable to reproduce. The author describes what is known about infertility and identifies priority areas for social science research on the subject. Sections review defining infertility, measuring infertility, the determinants and correlates of infertility, and the consequence of infertility. According to Zandvoort, 2001, many cases of infertility result from sexually transmitted infections, STI, and unsafe abortion, and there is no doubt that their prevention and adequate treatment are of utmost importance, especially as effective infertility treatment, if any, comes at a high price for the consumer, materially as well as physically. Medical infertility interventions are apt to fail a free market of provision because of major information asymmetry. This renders patients in low-resource countries prone to exploitation, potentially damaging practices and waste of their savings. Farland et al. In 2015 studied the relations of infertility, fertility treatment, and risk of hypertension. Clinical and population-based studies have identified racial, ethnic disparities in infertility prevalence, but have been largely limited to comparisons among blacks, Hispanics, and whites. As a result, the prevalence of infertility in American, Indian, Alaskan Native populations is essentially unknown. Whedon et al. 2017. The UNFPA 2016 brought a report on prevention and management of infertility in primary healthcare settings, an information booklet for policy planners, program managers, and service providers in health systems. Infertility, subfertility related health problems, problem behaviors, and risk factors that contribute to maternal and childhood mortality and morbidity have been described, and evidence-based interventions to address these factors as well as mechanisms of delivering them through existing public health programs have been outlined. Limited information is available pertaining to the ways biomedical infertility care is supplied and used in different developing countries and within low-resource contexts, though the number of studies in this area has increased over the last decade. Many infertile women in developing countries consider that without children, their lives are without hope. Wei-Yun Q reports on the burden many of these women carry and the lack of affordable care. When men and women attempt to have a child or to expand their family, the causes and the difficulties encountered can be complex. Many simple as well as more complex medical interventions can be attempted to help a couple or an individual to reach a state of pregnancy or to be able to maintain a pregnancy which results in a live birth. Although infertility has been described as an experience with long-term implications for the well-being of couples affected by it, few studies have examined any part of the aftermath of infertility. This article describes the ways in which infertility shapes the pregnancy course in couples who have struggled to conceive. Infertility emerged as important but only one of the number of factors altering the experience of contemporary childbearing. More studies now place infertility within larger social contexts and social scientific frameworks, although clinical emphasis persists. Methodological problems remain, but important improvements are also evident. Primarily, qualitative research to capture the experiences of infertile people in a socio-cultural context. We conclude that more attention is now being paid to the ways in which the experience of infertility is shaped by social context. Causes of infertility in women. Problems in ovulation are among the most common reasons for female infertility. It may also be caused by failure of the ovary to produce eggs, hormonal imbalance, and damaged ovary. Hormonal problems. One of the most common causes of infertility in women is dysfunction of the two important hormones, follicle stimulating hormone FSH and luteinizing hormone LH. These two hormones are produced by the pituitary gland during a specific period during each menstrual cycle, which induces ovulation. The complex balance of these hormones can be disrupted due to excessive physical and emotional stress and sudden weight loss or weight gain that in turn disrupts the periodic process of ovulation. Polycystic ovary syndrome (PCOS). PCOS or polycystic ovary syndrome is yet another major cause of anovulation caused by changes in the hypothalamus and pituitary gland which result in hormonal imbalance. In polycystic ovary syndrome, the production of follicle stimulating hormone reduces while levels of luteinizing hormone either remain normal or increases. All these conditions lead to premature development of ovarian follicles where an egg cannot mature properly. Cysts can also be detected in the follicle in certain cases. Tubal infertility. Damaged fallopian tube or blockage is yet another cause of female infertility. The blockage may be caused due to pelvic inflammatory disease or sexually transmitted infections of the uterus that blocks the sperms from reaching the egg. The fallopian tube may also be damaged due to certain previous surgeries of the abdomen, such as surgery for ectopic pregnancy. Another common cause of tubal infertility is pelvic tuberculosis. Damaged ovaries. Physical damage or infection of the ovaries may also be the reason for infertility in women. Multiple extensive and invasive surgeries of the ovary for removing ovarian cyst damages and scars the ovarian capsules to such an extent that it hinders the proper maturation of the follicles, that prevents ovulation and leads to infertility. Endometriosis. Endometriosis can be defined as the abnormal growth of uterine tissue outside the uterus. This abnormal growth affects the ovaries, uterus, eggs, and fallopian tubes, and also blocks the passage of the sperm to the eggs. Laparoscopy for infertility can be used to identify the growth, and it can be removed surgically. But surgical removal has its risks because it might scar the tube and affect the lining of the uterus. Abdominal diseases. Chronic abdominal diseases and bacterial and viral infections can also lead to female infertility. Most of the infections are caused by sexually transmitted bacteria and viruses that lead to inflammation, scarring, and damage of the fallopian tube. Abdominal diseases such as chronic colitis or appendicitis damage the abdominal cavity, which also leads to scarring and blockage of the fallopian tubes. Causes of infertility in men. Male infertility refers to a condition in which a male fails to cause pregnancy to a fertile female. The most common reason for male infertility is low sperm production and low quality of the semen. Low sperm production. One of the most common causes of male infertility is low sperm count, in which the testes produce fewer number of sperms than normal, and the sperm that are produced are of low quality and weak, that do not work effectively. The most common reasons for low sperm count are infection, stress, and dysfunction of the hypothalamus and pituitary glands that produce the male sex hormones. About 2/3 of male infertility cases are due to low sperm production and low quality of sperms. Infections. Testicular infections, mainly sexually transmitted infections such as chlamydia and gonorrhea, also affect sperm production and sperm quality. These infections scar and block the tube that helps in sperm transportation. It also leads to inflammation of the prostate, prostatitis, and inflammation of testicles that cause heavy testicular damage. But in most cases, sperm can be recovered and used in assisted reproductive techniques. Problem in sperm transport. Problem of sperm transport is the second most common cause of infertility in men. The tubes that carry the sperms from the testes to the penis might be damaged due to injury or illness, or it might be blocked, which cuts out the flow of the sperms. Those suffering from cystic fibrosis may also face the problem with sperm transport. 1 in every 5 male infertility cases is caused due to this problem. Hormonal problems. Another less common cause of male infertility is hormonal problems. At times, the pituitary gland fails to send the right signal to the testicles that cause lower production of testosterone, male hypogonadism, and lack of sperm production by the testes. Abnormalities in other hormonal systems such as the pituitary, hypothalamus, and adrenal glands also affect fertility in men. Varicocele. A varicocele is most common treatable cause of infertility. It is a condition of scrotal abnormality in which the veins of the testicle that drain it is dilated and swell up, thereby preventing the natural cooling of the testicle. Increased temperature of the scrotum is directly related to reduced sperm count and immobility of sperms. This situation can be treated to normalize sperm movement and improve sperm count. Surgeries or injury. Prolonged treatment and medication for certain diseases, radiotherapy or surgery for hernia, or correcting testicular deformities such as undescended testes or twisted testicles may cause infertility in men. Severe injury to the testicles during sport or a blow to it during a fight can cause permanent damage to the testicles by cutting out blood supply, thus disrupting the mechanism of sperm production. Stay aware about causes of infertility, but don't worry about them because there are several high-end infertility tests for both men and women through which the problem can be diagnosed in no time and treated effectively. Infertility problems have been a source of concern in India lately. Infertility is growing at an alarming pace, especially in the cities. Out of around 250 million individuals estimated to be attempting parenthood at any given time, 13 to 19 million couples are likely to be infertile. According to a 2013 World Bank estimate, the drop in fertility started about 10 years ago in India, with a steady 17% decline from the year 2000. Today, the incidence is around 10% of all those couples who may be trying to have a baby. Though many still believe that infertility is a woman's problem, the fact is that around half of all cases of infertility involve problems with the men. In the past, female infertility accounted for 60% cases and male infertility for 25% cases, while combined factors were responsible for the remaining cases. However, today the male factor is prevalent at 50% cases. In 1 in every 5th healthy man in 18 to 25 age group suffers from abnormal sperm count. In every 100 couples, 40% males suffer from infertility compared to 50% women. In the remaining 5%, the causes are common in both men and women. Today, infertility is no longer recognized as only a female problem. In fact, the term infertility is broadly used to denote a range of disorders, some of which affect the male, some the female, and contribute to childlessness in a couple. The most common reason for low fertility in men is low count and poor motility of sperm. Foods which increase the estrogen in the blood and toxins in the polluted air, among other factors, lead to poor sperm count in males. Other medical reasons are problems such as erectile dysfunction, early ejaculation of semen, cancer or infection of the genital system, exposure to chemotherapy or radiation therapy, diabetes, mumps in adolescence, or immunological infertility where antibodies are formed against the sperms. Certain lifestyle conditions such as diet imbalance, addiction to smoking or alcoholism, sedentary existence, or mental and emotional stress all contribute to poor sperm count. In women, the causes of infertility include fallopian tubal defects or disease, ovulatory dysfunction, polycystic ovarian disorder or PCOD in almost 40% of cases, endometriosis, hormonal imbalances like hypothyroidism, immunological factors, congenital abnormalities, and sexual dysfunction. Other common causes are genital tuberculosis, a chief factor in rural India and is on the rise, endometriosis, a condition characterized by abnormal growth in the woman's reproductive system, multiple partners, and sexually transmitted diseases that may permanently destroy the woman's reproductive system, obesity, use of certain medications, smoking, and alcohol consumption. Stress levels are very high among those living in the city. and that in combination with poor eating habits and an increase in medical conditions such as diabetes lead to poor quality and quantity of both sperms and eggs. There is also something called unexplained infertility, where doctors fail to come up with a medical explanation for the couple's inability to conceive. A hectic lifestyle and job stress contribute to reasons like a drop in libido and regular sexual activity among couples. Marriage is often delayed and childbirth postponed among urban couples. By the time the new age, career-oriented urban Indian woman is ready to have a child, her biological clock has already slowed down. Many women are unaware that from the age of 32, the ability to conceive decreases gradually but significantly and goes down rapidly after 37 years. Nearly 15 out of 100 couples need infertility treatment, and the numbers are only increasing. The infertility, which is part of reproductive health, needs more attention and research-based findings. More often, the finger points to women. The socio-cultural norms add further responsibilities to her to prove her maternal status. The reproductive health technologies, the in vitro fertilization, help the couple to get their children. The infertility can cause either by husband or wife. All these information and knowledge related to reproductive health technology should reach the communities for the welfare and development of the people. Thank you.